Good morning, Year 8. Today we will be learning about drugs and alcohol and how we can combat peer pressure. Firstly, we will learn what a drug is. As you can see, there are many different types of drugs, and they each affect your body in a harmful manner. Drugs are substances which affect the function of the brain and alter the mental or physical state of a person. This affects your behavior, choices, and feelings, making drugs unpredictable and dangerous. Next, we will delve into alcohol and how each beverage contains differing levels of the drug. You will notice that spirits contain the highest level of alcohol and beer is the lowest. Alcohol is a drug found in drinks such as beer, wine, and spirits. Alcohol is typically in the form of ethanol or ethyl alcohol. Consumption causes depression of the nervous system and can lead to a loss of coordination, impaired decision-making, and a myriad of diseases and injuries. There are two concepts known as risk and protective factors. These concepts are essential to understanding how teenagers can reduce their risk of participating in dangerous activities. Risk factors increase the chances of an individual using alcohol and drugs. Risk factors can include mental health issues, peer pressure, self-esteem issues, family problems, social life, and accessibility of alcohol and drugs in your local area. On the other hand, protective factors decrease the chances of an individual using alcohol and drugs. Protective factors can include education, community assistance programs, positive peer influence, general life skills, parental support, and positive role models. The final concept we will look at today is peer pressure or influence. This topic will be critical for our activity later in the lesson. Peer pressure or influence occurs when an individual makes a choice to do something to feel recognized and appreciated by their peers. Peer influence can either be positive or negative. Teenagers should find a balance between making informed decisions and maintaining positive relationships with peers. Peer influence can cause teenagers to choose the same clothes, music, hobbies, and lifestyle choices. Peer pressure can cause teenagers to participate in risky behaviors such as consuming alcohol and drugs or becoming involved in sexual activities. I will now give you two examples of strategies to combat peer pressure, which should give you more of an understanding when completing our activity later in the session. The first example is that teenagers should have a trusted person to discuss potential issues before they arise. The second is that teenagers should have a code word with their parents or guardians to use in the event of an uncomfortable situation. Before completing the activity, we will delve into the current statistics surrounding teenagers and peer pressure. The first is that 70% of teenagers started smoking cigarettes as they had a friend who also smoked. 55% of teenagers who have used illicit drugs did so because of peer pressure. Furthermore, images promoting alcohol consumption on social media tripled the chance of the teenage viewer experimenting with alcohol. The image at the top right explains the risks of mixing alcohol and other drugs. The graph at the bottom right shows that the main drug used by your age group is alcohol, closely followed by marijuana. For the remainder of the lesson, we will complete a 30-minute activity to devise strategies which could be used to combat peer pressure. Step 1 is to watch the video. I will give you the link shortly. Step 2, in groups, analyse the video and devise strategies which the young girl could have used to combat peer pressure. Step 3, in the same groups, create a similar scenario and devise strategies to solve the scenario. You will be presenting this 2-minute role play to the class during our next lesson. Step 4. To conclude the lesson, work individually to write a list of strategies which you could use in the future when faced with alcohol and drugs. You can now begin the activity. Thank you.